And it's my pleasure to introduce to you the next speaker, Dr. S.K. Mashira. He's the Vice President and President-elect for Telemedicine Society of India for year 2012 to 2013. And what he's going to share with all of us is on the topic of National Medical College Network. Please.
Thank you, Chairman. Good afternoon, ladies and gentlemen. So the topic that I'm going to cover you is a project that is the Ministry of Health, Government of India is going to implement. It's called National Medical College Telemedicine Network. Let's just see the scenario, why we need to network our medical colleges. We have been facing the pinch of the teachers migrating towards the corporate world. Obviously, there is a big attraction of remuneration in the private sector. So we are losing teachers to the corporate sector. So how to bridge the gap? Then we have problems with availability of the educational tools, all those in all medical colleges. And as you know that the current knowledge delivery are heavily dependent on highly technical environment. The journals and the books are expensive in medical science. So for a particular medical college, as you know that in most of the medical colleges are supported by the state governments, so you don't have that much adequate fund to take care of these reading materials. And the quality and type of patient materials, different geographical situations have problems with getting adequate patient material. Sometimes many of the patients are now going for the corporate private hospitals because they find that they don't have confidence in the government medical colleges. So there is sometimes a shortage of patients. Then our medical colleges are based in different environment, big cities, small towns. So naturally the patient profiles are again different. And there is a diversity of the quality of students because there is no common entry criteria for the national context. Every state have their own entry criteria. So naturally the quality of students will be different. So the purpose is to get a networking of medical colleges that can bridge the distance between the student and teacher, and also to take care of the shortage of teachers in medical colleges. And the quality of postgraduate education in Indian medical colleges needs improvement. And the tertiary academic medical centers can provide additional inputs through networking to medical colleges, and the mentoring process can fill some of this knowledge gap. So the objective is to improve the quality of medical and paramedical education and meeting the educational needs of the students despite paucity of teachers, facilitating cognitive component of learning by providing interactive teaching material online, developed by a group of competent teachers at undergraduate, postgraduate, and super specialty levels, to promote psychomotor skills development through telementoring, to link all the medical libraries with adequate stock of books and journals for access to all, thereby to all other medical colleges, thereby reducing the state expenditure on medical college library. And we have a digital library network, but the network is not expanded to all the medical colleges. To promote medical research by providing infrastructure for quick exchange of ideas and coordination with a group of researchers involved in a collaborative multi-center studies, and facilitating current information access through digital library network. We can introduce online continuing medical education program. We have so many technology available now, both real-time as well as offline, to enhance knowledge and teaching skills and possible accreditation of medical teachers and healthcare professionals. Implementing a uniform examination pattern and evaluation, coaching students with online and offline MCQs, enhancing computer literacy among medical students. Once you have this IT infrastructure, you can have some programs to orient newly entered health professionals, whether students or nurses or paramedical professionals. Facilitating e-health governance. Now for every meeting, they have to run to state headquarters. That can be done through this network, through videos, which is now very popular among the corporate world. sharing of resources and establishing effective communication between the medical colleges and its faculty, providing educational material and tools to medical teachers, improving quality and reducing the cost of healthcare delivery by teleconsultations for follow-up programs. So this is the objective and this is the need that I have given you, and this is totally very India specific. This may not be true in US or Europe, where such kind of situation may not arise. So how we are going to implement this project? Because this is a statement from my side as a researcher. I am not giving the official government statement. That I want to make very clear. But that is the prerogative of the Minister of Health to disclose all details officially through their web portals. Though I am working with ministry, but I don't have authority to give the official statement. But this is what I am saying is going to happen, and this is the way things are happening. So what we are going to do is we identify one of the center which have considerable experience in practicing ICT for health. And in that process, I can give you the statement now that the center at Lucknow has been identified as a National Resource Center, because this resource center has been created by the IT Ministry, which is later now adopted by the Minister of Health, thinking at the considerable inputs they can get from a established National Resource Center. So now this will be networked with some of the regional resource centers, which will be based in apex medical institutions, the offline. I can inform you that the research centers are now going to be established in Chandigarh. That is the postgraduate institute, which will be given the responsibility to mentor the medical colleges in the states of Jammu and Kashmir, Himachal Pradesh, Punjab, Haryana, and Chandigarh state. Now, in Chandigarh UT. Then there will be another resource center in All India Institute of Medical Sciences that will connect to all of the central states, Madhya Pradesh, Rajasthan, Chhattisgarh, and Uttarakhand, and besides the Delhi state. This is the earlier plan on MPLS VPN network, but when the NKN has now come, now it is going to ride over the NKN. All of you may not be knowing NKN. NKN stands for National Knowledge Network. This is a high-speed fiber optic network spreading all over the country, connecting all the educational institutions, health, engineering, science, agriculture, so on and so forth. So this particular network is dedicated for educational purpose, and this is going to serve the medical colleges also. Currently, so this particular network bandwidth is changed now. Now it is going to be 1 gigabyte to each medical colleges and 10 gigabyte to the regional resource centers, and the National Resource Center may get 100 G. So currently, the National Informatics Center is implementing this NKN project, whereby they are giving the bandwidth and terminating at medical college level, and inside medical college, then the responsibility of the government, the state government, or the institution itself to take it forward. So now this Minister of Health project will invest money in developing the endpoints in all the medical colleges which are of government supported. And subsequently, in years to come, the private medical colleges also will be included. What kind of mechanism developed that I cannot commit now, and it will come out from the ministry. But I'm sure that the private medical colleges also will be benefited with paying some charges, I believe. Each medical college telemedicine nodes to be linked with district hospitals. That is not part of this medical college network, but that again will be supported by the National Rural Health Mission budget, but that is in agenda. But this particular data is only meant for education and skill transfer. The second roadmap scenario will be one lecture theatre of each medical college will be converted to a digital integrated medical lecture theatre, providing necessary infrastructure. Now, the Ministry of Health, Government of India has taken the pilot that was undertaken in by Government of Uttar Pradesh, which was designed by us at the National Resource Centers. That model is now accepted. That I will share with you in a couple of minutes now. Each resource center will have facility for multimedia and education content development, so that this All India Institute of PGI Chandigarh, they will be given infrastructure and manpower to generate content. As you know that in e-education ecosystem, the content is the most important factor. All the medical education knowledge content will be stored in central repository located in data center of National Resource Center with backup facility at disaster sites, and the resource center will also have storage systems in their own premises, and this will be protected with all kinds of security systems, and this will be National eCME portal. And all the resource centers can upload their contents into this common portal. The network will support medical multimedia, data exchange, multi-point video conferencing, both in interactive as well as video broadcast mode. And the central repository of medical education content will do live transmission of the content on day-to-day basis, and also offline with username and password to all medical students, teachers, and nursing, and all kinds of health professionals. The entire network will provide a platform for interactive distance learning and adaptive environment for medical students, teachers, and healthcare professionals. It will also support digital library network. Currently, the digital library network is being housed at National Medical Library in New Delhi, and some of the central medical institutes are now networked, and with the funding, that this network will also traverse on the National Medical College backbone. Ultimately, a National Virtual Medical University can be established at national level. Now, some of these case studies were shared with the Minister of Health Committee, and they have accepted this kind of case studies that has been in practice in my center. And some of those case studies I like to share. One is the environment of a teleconsultations. Basically, the teleconsult that is going to happen between medical college and their resource centers are basically case discussion, and this is entirely for two purposes: case-based learning for the students as well as a clinical decision support system. Otherwise, it's not the same environment of teleconsultation that is coming from a rural center to a district hospital. It's entirely different issue. This acts as also educational environment. These are some of these case studies that was shared with the government, and government has accepted these models, and we are going to ride on that. So I can just show you some of those quickly, some of the screenshots, and practiced for medical students with medical colleges in the states. And some of these are also connected to district hospitals. Those case studies are also shared with them, because district hospital doctors needs to upgrade their knowledge. So this things has to be taken care by the medical colleges. So these medical colleges in turn, in the down below, they have a responsibility of the knowledge sharing with their district hospital doctors. So this will create a good bondage, and it ultimately is going to benefit the patient. So we hope some of the referral will be cut down to medical colleges, because now the medical colleges are heavily crowded, so that is very difficult to manage. All kinds of professionals, nursing, dental, paramedical workers, there are different case studies as being practiced in different institutions. You can see one of the environment that in our institutes where the nurses in referral hospitals are getting trained with very simple nursing technologies. So there are also network between peer level, same level institutions, whether it is tertiary level, they are now networked, and considerable activities are going on between these institutes, and there is good knowledge exchange. And that example is also shared with the government, and government has accepted that kind of environment. You can see here, and there is no differentiation between government and private. You can see here Amrita Institute, Cochin, and are being constantly networked with our institute, All India Institute is networked with our institute. And one of the things that is Government of India has really interested to get it implemented is telementoring. We need to mentor our fellow surgeons, our fellow physicians for interventional procedures. Now they accept such kind of things are very, very relevant for investment they are making. And some of these experiences were shared with them. This is one of the event that we shared with them, how we using satellite technology with a minimum bandwidth of 512 kbps, we could demonstrate a telementoring exercise leading to a successful operation on a patient who has been operated thrice without a success, and the fourth time with telementoring. But this requires a lot of understanding between the surgeons or interventionists, requires good friendship, good understanding. Nobody is big, nobody is small. We are all for the patient. So that kind of feeling has to be there to help the patients to travel to larger organizations. It's very important to need to develop subspecialty, and for that we need to be mentored by a appropriate center. So we have also developed the research on that, and we have proved that the subspecialties also can be developed in peripheral medical colleges. This is well documented and peer reviewed and published in literature. So that is one of the area that we want to also develop in our country through this network. So as you know that, these are some screenshots I have taken. Many of these sites are in operation in US and Europe, where even the handheld devices are also being used for telementoring and also accessing the knowledge from a stored content site. So one of the famous site, websearch.com. Earlier they used to charge for these services, but now it is available free to developing countries. We have similarly several sites available not only for the professional education, also for the public education. We talked about public education yesterday in the afternoon. This is also possible through this network. This entire national network project is based on this pilot undertaken by us in the state of Uttar Pradesh. In the state of Uttar Pradesh, we designed the network to link all medical colleges here. We used the totally IP-based video configurations, and we used the conventional video conferencing systems. There are many of the vendors available in India, and they're all reputed companies. So what you have done in this, that the problem is digging, putting a local network with cable is dangerous because we don't have any map in the medical college. You can break their existing pipe, water pipe and cables of electricity. So what you have done is you have linked all these three centers, or digital lecture theater, digital library and teleconsultation facility with a WiMAX network, wireless network. So the library here, the configuration like this, we use a thin client configuration connecting to 20 workstations. The time is 2 minutes more. So 20 workstations connected to 2 servers, and we don't provide any provision for downloading any content by the users. So thereby to protect any virus problems. So they can access it online, and there will be only one point where they can take, which will be protected with appropriate security systems. This is the complex that going to be used as a national resource center, because it has developed with the enormous amount of funding from the government, and the Minister of Health thought that why not use this existing facility rather than creating a new facility to create a resource center. And what I have done from different project grants is heavily invested on content development. This is our environment that if you have come down, some of you have seen this place, that it looks like a totally heavily IT dependent and with all modern multimedia environment. I will not go into details about that thing, but the infrastructure is ready to take care of the national need, and we are not now contemplating the digital operation theater. That will be the second phase. We are working on how to make a low-cost surgical video network, but we are envisaging to create a network lecture theater that is more relevant for our requirement. This is the project we have just completed to develop environment for surgical education. Currently, we watch surgery standing in a gallery. We don't get to see anything because you just see the head of the surgeon and assistants. And this is the telepresence technology that that we have developed now, and it is now going to be inaugurated very soon. If this model is acceptable, this will be replicated. This is our infrastructure to develop the content. We have developed the infrastructure in such a way that we don't require any preparation. Just press up a button. You have seen the broadcast scenario. They survey the channels. So here we monitor all our knowledge generation points, operation theater, seminar room, anywhere. So we have developed inter-hospital network. We can capture a content just by press of a button, and every 15 days these contents are either destroyed or you edit it and keep it. So we have a policy of that. So we don't keep on accumulating that. We have currently 65 terabyte of storage space, and with this national network coming in, we'll have more storage space. We have developed very high-end infrastructure for our editing systems, both in Apple as well as PC platform. This is our data center here, where you can see, now you can see only 3 or 4. It's going to be filled up in another couple of weeks. And this is our network operating center here on the right side. And the proposed national medical network also will follow similar configurations. You have described the hierarchical structures, national hub to regional hubs to medical colleges, same hierarchy. And thank you very much for your kind attention. This is going to be implemented very soon. I did not tell you all details of the implementation process because I am not officially authorized so, but this is what is going to happen. And you will find very soon there will be an announcement by the ministry. Thank you very much.
Thank you, Professor Mishra, for a very exciting days ahead of connecting all the medical colleges. And I think that would be a very interesting initiative by the government. And on behalf of the organizing committee, may I request you to accept a small token of appreciation.